5:34 p.m. 22nd September 2017. This is a Be Kind Vets veterinary educational video sponsored by Toa Payoh Vets. As this video contains surgical footage, viewer discretion is advised. Today, Dr. Singh will be doing a guided demonstration for young vets on how to spay a female dog with minimal skin incision. Our patient today is a 10-month-old female Maltese crossbreed.
Okay, the spay has been done about half an hour ago, and I'm doing a video to teach the younger vets how I spay a dog with the minimum length of skin incision. As you can see here, now what I do is I look for the umbilical scar. This umbilical scar, which was where the umbilicus was. So normally from here, I will estimate for this small breed. I will estimate about 1.5 centimeter. My incision starts here, 1.5 centimeter from the umbilical scar. So from here, from this 1.5 centimeter, then I will take the scalpel blade and cut more or less 1.8 or 1.8 centimeter. So that this is the shortest skin incision, which is available to take out the ovaries and the uterus. Now, as you can see, this is the ovary and uterus. You have to hook up. Okay, so the ovary and uterus will be actually here this way. Okay, then when you incise, you come out inside already. When you incise, when I come to this side, when I do the skin incision, then I cut into the linea alba and the muscle and separate, and then I have to hook. So you come to my side, I'll hook in. So I have to hook up the uterus. So normally I do 45 degrees. Go in 45 degrees, turn the hook and pull out. So I demonstrate here. I go in, then I turn the hook and hook up. You see, hook up the left uterine body first, uterine horn first. Hook up, and once you manage to hook this one out, the other one is easy already, because the other one just follows this one. So this is where many young vets cry, because sometimes they try and hook, but they can't get it. So they hook 10 times, 20 times, they can't get it, because sometimes the dog is too fat. Sometimes they can't manage to get the right location. The location is more or less 45 degrees to the skin incision, 45 degrees, and then you turn your hook around and then pull. So if you don't turn, obviously you cannot. So you go in below the uterine horn below, and when you're going below, then you go in below there, and then you hook up. It's easily said than done actually, but of course for me, I have so many years of experience, so I can manage to get it. Even for this dog, it's the third time. So I did one time, nothing. 2 times, nothing. The third time, the uterine horn was hooked up. So I will consider that a relief, because sometimes it's really hard to get it. So once you hook out, then the other thing is just tie and all this. So I won't explain that. That one is the standard. So I just want to explain that to get the smaller skin incision, which the owner is most happy with, you really need to get this distance, the start of the incision to the umbilical scar. Umbilical scar is around here. I don't think you can see, but some of them is more obvious. So it's about 2 centimeter. So you don't go 1 centimeter, because then you can't reach the uterine horn, uterine body. You can't reach. So it's too short. It's no use. Too long, too far away. You cannot get the ovaries. Now some vets they cut a bit far. Let's say instead of 2 centimeter. That applies to the cat also. They cut at 1 centimeter, or let's say they cut at 3 centimeter. So if they cut at 3 centimeter from the umbilical scar, So they cut here and then they cut this side. So that means the ovary is too far away. So when they pull to tie the ovarian ligament, the whole ovary breaks. So when it breaks, of course, the ovary drop in. It drop in here, and it's really a big thing, because that means the dog will come and hit again, because the ovary has dropped in, and then the vet completes the surgery. Now that is no good for the owner because of for the dog, because the dog will keep cycling because of the ovarian tissue. Sometimes the ovary is so hard to tie because the incision is too far and the vet doesn't want to enlarge. Normally you should enlarge the incision. You will find that the ovary is too far away and too tight, then you just increase the incision, the skin incision, so that you don't put tension on the ovary. Because once you put tension on the ovary, you put tension on it, the ovary might just break. You see, the ovary might just break because you keep pulling, and then the ovary will just break, and some pieces might drop inside. And so if there's any ovarian tissue, then you have problems already, because the dog will come on hit again, and that is called stump pyometra. Sometimes they call it, because the dog or cat will start to have infection older age, and then this infection will come from here. They call stump pyometra. Now you can see that there should be no bleeding, and now my assistant will just tape it over. Now normally I have a protective plaster so that the dog doesn't lick it, and then normally I don't give the collar, especially if it's possible. Then the only complaint is sometimes the dog is allergic to the plaster. Now this plaster is a bit too big, I would say, too big. Normally, ideally the plaster should just not go around the nipples actually, but it should be, plaster should be just a bit longer. But then anyway, this is much firmer. Yeah. Okay, now I'm going to give the antecedent, and this dog was given Domitor plus ketamine IV for sedation, and now I will wake her up by giving the antidote called antecedent. Now she's not fully awake yet, so the antecedent will reverse it. Now before that, I'll give the painkiller antibiotics, which is Baytril plus Domitor subcutaneously, so that there is no pain. Okay, so this is a standard procedure in Toa Payoh Vets. Then the other thing is this suture inside is absorbable, so the owner doesn't have to come back for stitch removal. There's an advantage for the owner. Now I'm going to give the antidote now. It's called antecedent. Now you can see the time, 5:42. Now between 5 minutes, the dog should be awake already. So you see, I'm going to give IM. Okay, so it's 5:42. Now this e-collar may be too big. This, what size is this?
15.
So normally size 14 or size 12. This is more. Now this is more like cat. So actually the dog is already, the gums are okay. You see, a bit pale. Well, normally anesthetic, they do have pale gums, but the tongue is okay. You can see the color. Now you see it's going to get up. You see the effect of antecedent, which is quite good. You see the dog. It's like antidote to Domitor. I give Domitor 0.15 IV, ketamine 0.2 for this dog, weight of 4.3 kg, and you can see now he's really a bit more able to stand up. You can see that, you see, because Domitor sedation has been reversed. Now it's only how many minutes? 1 minute only. So you see that it's 5:43. So by 5:45, I mean, well, because it's 5 minutes from 5:43, so 5:48. The dog should be standing up already. But even then you see he's putting his legs up there, you see? Now you can see the dog on this side. You see, yeah? Now you see a bit, there you can see. He's back to normal, you see? He's not like, his breathing is back to normal and the heart rate has started to go back to normal. Now we give the e-collar to prevent any biting. Then painkillers. See the dog, you see? And that's about less than 5 minutes from the injection of antecedent. So some vets they prefer not to inject and let the dog wake up by herself. For me, I prefer to inject so that the dog is alert, you see, and then back to normal respiratory respiration back to normal, you see, so that I don't have to worry whether the dog is going to sleep a long time or not. But some owner says that the dog sleeps a long time after the spay, and of course the owner worries it's sleeping so long due to the sedation effects. Now you see, how much time? 5:45, only 2 minutes, right? Just now was 5:43. Was it 2 minutes or 3 minutes? Yeah? See? Much difference because of the antidote. Okay, thanks a lot. Yeah. So